Hello everyone and welcome to my channel. My name is Rekiyah Baker. I am a graduating senior at Hampton University. Thank you all so much for tuning in, and today I will be presenting my research proposal. The proposed study will evaluate whether adding foods high in vitamin D during pregnancy prevents schizophrenia in childhood. This design is a quasi-experimental design consisting of a randomized controlled trial experiment. It is hypothesized the use of vitamin D in expecting mothers prevents schizophrenia during childhood as a result of the body's control of the gastrointestinal tract leakage. Schizophrenia is a chronic and severe mental illness that affects about 1% of the population, more than 2 million people in the United States alone. According to the Diagnostic Statistical Manual for Mental Health Disorders, schizophrenia is diagnosed when you have two of the following symptoms: hallucination, delusion, disorganized thinking, disorganized behavior, or other negative symptoms of schizophrenia. You must have these symptoms for a period of 1 month or more. The leading treatment for schizophrenia is antipsychotics. Antipsychotics can be taken orally in the form of a pill or given as an injection known as depot. Antipsychotic drugs are the antagonists on a number of neurotransmitter receptors in the mesolimbic pathway of the central nervous system. The objective of antipsychotics is to block the effect of the chemical dopamine in the brain. The gastrointestinal tract. The gastrointestinal tract is an organ system within humans and other animals which takes in food, digests, and absorbs energy and nutrients. It also removes the remaining waste as fetus. Vitamin D deficiency correlated to gastrointestinal disorder symptoms. A study conducted in 2016 reported a significant relationship between vitamin D deficiency and intestinal disorder symptoms. Participants were randomly selected to receive vitamin D3 or a placebo for a period of 6 months. Results showed a significantly greater improvement in irritable bowel syndrome and overall gastro symptoms with the higher levels of vitamin D. 100 pregnant women will be collected from 5 Planned Parenthood clinics in the Washington, D.C., Maryland, and Virginia area. Participants will be selected using a systematic random sampling technique. Participants will be separated by race and then put into a system and randomly selected. Participants will be asked to sign a consent form before participating in the research study. Participants will be given an oral and written in-depth description of the study. Participants will then be asked to include a list of foods that are high in vitamin D into their diets. Schizophrenia will be measured using a psychological examination with DSM and an fMRI screening. A 25-OH-D blood test will be conducted at the end of each trimester to determine the participant's level of vitamin D intake. After the participants give birth, the child will then be measured over a 13-year. The child will then be given a DMS screening and an MRI scan at each cognitive developmental stage. According to the Diagnostic and Statistical Manual for Mental Health Disorders, to meet the criteria for diagnosis of schizophrenia, the patient must have experienced at least 2 of the following symptoms: delusion, hallucination, disorganized speech, disorganized behavior, or other negative symptoms of schizophrenia. A MRI will be performed to provide researchers with imaging of certain regions of the brain associated with schizophrenia. The most recent 7 Tesla MRI model will be used, the Magnum Terra. Participants will come to the local hospital with the child for the MRI scan. During the scan, the room temperature will be set to 74 degrees. During the test, the child will wear a hospital gown and asked to lie on the table. Participants will then be asked to place their head in a brace and to hold still. Then slide head first into the MRI. While the machine is scanning the participant's brain, they will be asked to tap their thumb against each finger to create activity in the hypothalamus. Researchers will focus on measuring brain activity in the frontal lobes and hypothalamus. A clinical examination, blood tests, and stool analysis are administered to the child to measure the gastrointestinal tract disorder symptoms. A alanine trimose blood test will be conducted to look for blood count and liver functions. If the liver is damaged, it will release more ALT into the bloodstream and levels will rise. Each stool analyst, a stool sample will be collected in a clean container and sent to the laparoscopic examination. After completing the trial, the general linear regression model will be incorporated to compare the results of the vitamin D deficiency and schizophrenia development in brain. Thank you all so much for watching. Make sure you like on Facebook and don't forget to subscribe. Thank you all so much.